Dear colleagues, my name is Johannes Steinhardt. I'm a specialist in fetal medicine and the head of the Department of Fetal Cardiology at the Heart and Diabetes Center in North Rhine-Westphalia in Germany. Together with the University of Homburg, Saarland, we have conducted the world's first prospective study with a high-end ultrasound simulator into virtual moving fetus. We investigated the learning curve and skills of medical students without ultrasound experience during a systematic ultrasound simulation training for the second trimester scan on a randomly moving virtual fetus. The learning curve was compared with the performance of OB/GYN physicians and experts. The students are the intervention group. The reference group represents a group of intermediate skilled physicians, residents and consultants. They had performed a median of 750 gyn-obstetrical scans and 570 fetal scans according to the German maternity guideline. The expert group is a highly skilled group of 10 DEGUM specialists. They had performed a median of 50,000 gyn-obstetrical scans, 8,000 fetal biometrics, 6,000 diagnostic ultrasound examination according to DEGUM level 2, and 2,500 fetal echoes. Interesting is the median experience of the reference group is near by the German Facharzt level, means board certified or CCT. The intervention group underwent a systematic 6-week ultrasound simulation training after a 90-minute theoretical introduction into obstetrical ultrasound and a 30-minute individual introduction to the with Mentor ultrasound simulator. The training consisted of 2 individual 1-hour hands-on sessions on a second trimester scan per week. Performance assessments for the intervention group were carried out after 2, 4, and 6 weeks of ultrasound simulation training with a standardized test. Performance assessment of the reference group was rolled out using the same test after a 30-minute introduction to the mentor. The participants were asked to acquire 23 second trimester planes according to the ISUOG guidelines in a realistic simulation B mode with a randomly moving fetus as quickly as possible within a 30-minute time frame. How does the simulator work? We see the monitor of the simulator. In the middle is the ultrasound simulation. Automatic labeling is turned on. The bar on the left shows the ultrasound planes to be practiced. The abdomen is enabled. On the right side, there's a 3D fetus. You can follow the cutting plane while scanning. In the 3D fetus, you can change the presentation of the plane and thus see the organs in the fetus. That makes it much easier to detect and learn the ultrasound structures on the left. Down right, you can see the position of the ultrasound probe on the abdomen and a picture of the plane to be practiced. Here you see a student and the introduction to the ultrasound simulation mentor training. Here are the results. After only 12 hours of structured self-training, the students reached the physician's rate of appropriate obtained images and performed significantly faster. The students obtained 20 out of the 23 second trimester standard planes without significant time difference when compared to the expert group. Still, the total scanning time of the expert group remains significantly faster. Here are the very interesting results. You see the total time to completion of all planes together, the students group after 4-hour training, after 8-hour training and 12-hour training. The red group are the physicians, the green group are the experts. After only 4-hour training, there was no significant difference between the students group and the group of physicians. After 12-hour training, the students were significantly better than the physicians, and there was no difference between the students and the experts. Here you can see examples of the standard planes. The blue group is the students group, the green one the physicians group, and the red one the experts group. You can see differences in the difficulty of the different planes. For example, the femur was relatively easy to adjust for all groups, but the facial profile was much more difficult. It is interesting that standard levels of fetal biometry, such as the fetal head, could also be adjusted relatively slowly by the physician group. Conclusions. A systematic ultrasound simulation training on a simulator with a virtual randomly moving fetus is highly effective. Novices can obtain skills close to expert levels within only a 12-hour self-training. So, we recommend the use of simulator training for learning of second trimester scan. Thank you for your attention.